Hi, my name is Bridget, and I work for Massachusetts General Hospital in the physical therapy department, and I work for Myhre syndrome clinic. I did this presentation with my colleague Jess Garten, but I'm going to be presenting today. Just so you guys know, I have no financial disclosures that are relevant to this presentation. I have some learning objectives. So by the end of this, I'm hoping that you can understand the role of physical therapy in annual evaluations for patients with Myhre syndrome. Learn common impairments that we've seen during our annual Myhre clinic evaluations, and learn some of the physical therapy interventions utilized with patients with Myhre syndrome. So while everyone with Myhre syndrome is different, here are some common characteristics listed by the Myhre Syndrome Foundation. The highlighted characteristics are ones that physical therapy evaluates, tracks over time, and prescribes exercises designed to help slow progression. With consistent exercise, we have seen improvements in multiple categories. So you can see the biggest thing for us in physical therapy is restrictions in joint mobility and trouble with breathing or chest expansion. For the evaluation at our MGH Myhre clinic, we do yearly evaluations of posture, gait mechanics, range of motion, including the shoulders, hips, knees, ankles, spine. We do a gross strength assessment. We assess breathing mechanics, and especially rib cage stiffness. We also measure aerobic capacity via walk test. And for our pediatric patients, we also look at gross motor development and milestones, and we discuss services that they are having either through school or at home. So some typical things we've seen in clinic with posture and walking mechanics or gait, specific to Myhre syndrome, happens to relate to the amount of tightness that the person is presented with. But some of the things we have seen is rounded shoulders, slightly bent or flexed knees, and a widened base of support. The walking pattern is sometimes widened as well, with decreased heel-toe pattern, meaning that they will have a hard time striking their heel because of calf tightness, and also tend to push off a little more with their toes because of calf tightness. We'll also see decreased arm swing and decreased trunk rotation. And sometimes we see toe walking happen, especially with increase in calf tightness, so that's something to look out for. So some common range of motion restrictions that we see in Myhre syndrome are related to flexor tightness, so they tend to be a little bit more tight in bending. So stretching out straight and with extension and rotation tends to be helpful to stretch into. In Myhre syndrome, we like to keep track of potential motion restrictions so that we can provide intervention strategies or keep the restriction from progressing. Especially, we don't want it to become a functional limitation. So we often utilize stretching and or bracing to keep range of motion restrictions from progressing because we don't want them to become a functional limitation. For chest wall restrictions or chest wall tightness and measurements, we tend to look at the sternal angle, the xiphoid, and the umbilicus. So for breathing pattern and aerobic capacity, we're going to assess breathing pattern at rest and with activity. We're going to measure rib cage excursion during breathing, and we're going to measure inspiration with a maximum inspiratory pressure device. So some common tests that we tend to perform and keep track is we like to do muscle endurance tests, like a 30-second sit to stand, to test functional exercise capacity with a 3-minute or 6-minute walk test, and that's great to measure changes over time. And for our kiddos, we usually do the Peabody, which is considered the gold standard for gross motor developmental screens. We make recommendations based on the impairment seen and also the child's current therapy services. So depending on strength and gross motor development of the children we see in Myhre Clinic, we like to ask certain questions like how their development has been so far, any sort of limitations, and how can we help? What sort of things are you guys doing at home? What sort of things are missing from the program? We like to check on child service plans with their therapy services like PT, OT, and speech if applicable. And we also will check on things like how they're running, jumping, skipping, how their balance is, and if there are range of motion restrictions, if they have any, if they're affecting their participation in the community, And we want to watch out for any changes in their mobility. So parents in particular, even the person with Myhre syndrome, would want to look out for any changes in their functional mobility if they're having changes in function, like they're not able to transfer from the floor as easily, they're not reaching for things as smoothly, their walk has changed, their standing has changed, things like that. When it comes to common interventions that we tend to recommend, we tend to recommend stretching and bracing, and also any sort of gross motor skills or balance skills that could be used in their home exercise programs at home. For bracing, if their range of motion is limited, we'll recommend day or night bracing. These may include common braces like ankle foot orthosis or superior malleolar orthosis, or night stretching braces for any tight joints, just so you get a sustained stretch over a long period of time. Also, regular stretching is really important to keep range of motion, and then it will be easier to maintain it. I have some additional examples. So for breathing exercises, we want to help facilitate chest wall expansion in the hopes of delaying rib cage stiffness. A stiff rib cage prevents full lung expansion and results in restrictive lung disease. Muscles of respiration, as well as other major muscle groups, can be optimized with regular aerobic activity. If your leg and arm muscles are more fit, you will be able to extract oxygen from the bloodstream, and it lowers the demand from your heart and lungs. So it's always fun to have kids play with blow toys or bubbles or blowing up balloons. And of course, aerobic activity will help prevent any deconditioning. Find something you like to do for aerobic activity, because or else it's just hard to keep going with it, right? Find something you like or your child likes. Typical things I like to ask people to look out for, and I mentioned this a little earlier too, please check in with your local physician or your local physical therapist if you're noticing anything different with your child or with yourself. So certain things like increase in stiffness in walking. So for instance, like you're seeing your child go up on their toes a little more, they might be getting a little tight, or they're standing with a wider base of support when their toes out a little more. This may be signs that their calf muscles are getting tighter, and we need to work on stretching for that, or potentially put some braces on to keep them from getting tighter. Any loss in function is something else to look out for. So we want to make sure that the adult or child is not changing in their level of function. That's a warning sign to come and get assessed somewhere by a PT or a physician, or anything where they seem more crouched or bent in their posture. It's another thing to look out for. So of course, check with your local physical therapist for any additional stretches and exercises. These are just common ones that we tend to prescribe. based on limitations we have seen. So of course, yoga, even just laying on your belly to try to get nice and straight and maybe having your kid or yourself play some video games on your belly can help stretch. Um, because of the tendency to be more bent or have flexor tightness, um, things like swimming or yoga, um, heel walking, hamstring stretches, trunk rotation, all those things are really great to work on motion and keep motion and keep it from regressing potentially. Some common questions and concerns that I've seen in clinic, I get asked a lot if progress can be made. And patient and family members ask that a lot. And based on our experience and limited frequency dictated by the rarity of Myhre syndrome, it does appear that patients with Myhre are able to make range of motion gains with typical interventions like stretching and bracing and joint mobility. But everyone with Myhre is different. So it's great to gather at least annual information, biannual information, even locally, to track changes over time, just to monitor for potential stiffness. So the other question I get a lot is, how do I or my child compare to others with Myhre syndrome? And this is a hard one because everybody's very different. Every person that I've seen just presents differently. So just keep up what you're doing, and you do your best with what you have, and we'll get you on a good plan, or you get on a good plan with your local physical therapist. And I'd say what to be aware of moving forward is, again, the things I mentioned, is making sure that you're not seeing any functional decline or increased stiffness. So you want to catch it before you get it even tighter or your child gets tighter, because it's easier to catch early and be able to maintain or progress or improve that motion. All of these pictures in these slides are not copyrighted. I just wanted to let you know that. And that is it for my presentation. I want to thank you and enjoy the rest of your day.